So again, everybody, my name is Alexa Tinsley. If you don't already know me, I am the Director of Programs for Jett Foundation. I want to thank you all for being here today to join us on the topic of fat embolism syndrome, or FES. We have heard a lot of need for education about this topic in the community, so we're so very grateful to Dr. Phan, Perlita, and Yulanda for sharing their knowledge and their experiences with us today. So I do just want to share a little bit about you. Oh my gosh, share with you about Dr. Phan. If you don't already know her, she is a pediatric neurologist and sleep specialist who is highly passionate about clinical trials of neuromuscular diseases, specifically in DMD and SMA. She's also a member of the Pediatric Advisory Board at the FDA and a researcher at CDC Newborn Screening Branch. She's also currently the principal investigator at the Rare Disease Research Center, overseeing ongoing studies in neuromuscular patients. And I also know that she does a lot of other things. She's associated with the University of Alabama. There's a lot of things that she's doing. So very excited to have her here to share her knowledge on this topic. We also have Perlita Hains and Yulanda Kirby-Kiser here to share their personal experiences with FES and working with doctors, advocating for yourself and your child in this emergency situation. Perlita's youngest son, oh my God, I can't speak today. Levi lives with DMD. She's also a very active advocate and voice in the Duchenne community. Yulanda is a nurse of 26 years and a mother of 5. Her youngest son, William, who is 15, lives with DMD. He recently had a fall with a fractured femur that brought attention to the need for further education to medical staff regarding FES in the DMD community. And today she'll be speaking to us about William's journey and hopes to help other children and families become confident in advocating about Duchenne. So before we get started, I do just want to mention a few things. This webinar is being recorded, so if you have to log off for any reason, it will be recorded on YouTube, and we also are live streaming to Facebook, so it will be available there later as well. Or if you know of anybody that wanted to be on this webinar but was not able to, or want to share it later on, it'll be available as well. We will be answering questions after Dr. Phan's presentation and Perlita and Yolanda's experiences. There is a question box in for me, bottom right. It has a little chat box with a question mark in it. We do primarily look at those for our questions. We do try to monitor the chat, and we do try to monitor Facebook as well, but that is the primary place we go to answer questions. So if you do have them throughout the presentation, please feel free to put them in there. There is also closed captioning and language translation if that's something that you need. So there's a CC button at the bottom of your screen where you can click to it. There's a full transcript available, and you should be able to pick the language that you need. So with that, that is all from me for now, and I will hand it off to Dr. Phan.
Thank you, Alexa, for the kind introduction. This is rather a timely topic, given that there's a number of case reports and patients with this condition that is now being reported. So first, good afternoon. I like to start by thanking Jett Foundation for this opportunity to raise awareness to fat embolism syndrome, also known as FES. My name is Phan. Alexa has mentioned I'm a pediatric neurologist. I'm also a principal investigator at Rare Disease Research, among a couple other things that I do. It is an honor for me to present this to the community on behalf of Jett Foundation. So if, obviously when you're on this webinar, you are either a caregiver, a parent, or has someone in the family with DMD, or even a friend with DMD. You have a number of things to worry about on a regular basis. So I hope that after this seminar, this is another thing to add on to your million list on a daily basis. But I think it's an important topic to cover and to present and to discuss, simply because we want to make sure that this is on your radar and you're aware of this type of occurrence that can happen, and it is a medical emergency. So when we talk about emergencies, whether it's medical or non-medical in DMD patients, there are a number of things, right? So the first thing that everyone calls me for or have emergency per se is the missing of steroids. So if they're undergoing surgery or they're away on vacation or they're just short on on steroids, that's always a concern leading to adrenal crisis. Um, and of course, there's many other sort of emergency situations, like, if you're running out of refills, who do you call for that? Missing doctor visits, and not that you have just one doctor visit to keep track of. There's many doctor visits that you have to keep track of. And then missing infusions, whether it's be bone infusion, exon therapy infusions, etc. And lastly, missing school can be a bit of an emergency or anxiety-provoking events for some of our family and patients. In my household, and my 15-year-old teenage daughter, emergency is that she can't find stuff to wear when she goes to school in the morning. So it's all relative and depend on who you ask, right? So fat embolism syndrome can present a number of ways. And recently, there has been a number of reported catastrophic outcome, which brings us to present this topic. But it has not been well characterized in the past. And I believe that there are a number of unreported cases out there. But typically, they tend to present in a very classical, and a essentially in three different systems. And what you see are the first and most common symptoms are pulmonary distress. This is medical emergency and needing to seek immediate medical care. Um, the second most common is neurological symptoms. And this can present a number of ways, and we'll go through a list of things to look at. And then lastly, can be skin manifestation. So these are a triad of multiple signs and symptoms that one needs to be aware of if you're taking care of someone with Duchenne muscular dystrophy. So what do you see in respiratory distress or respiratory symptoms? The first thing is tachypnea, which is a medical terminology indicating fast breathing. And that can occur in 88% of the patient. Hypoxia, that is low oxygen. Tachycardia, which is high fast heart rate. And these are classic respiratory distress and symptoms that one should look for if fat embolism is on your radar. The next is neurological symptoms. And this is rather obscure and can be fairly subtle if you're not paying much attention to it. In this category, what you see are a variety of things like confusion, agitation, lethargy. Seizure is not that common but can be seen, or even unresponsiveness. So a lot of times after a fall or some kind of injuries, what you can see are some of these neurological manifestations. And a lot of times these are so subtle that you may not even see, but be on a lookout for these. And in fat embolism syndrome, 83% are under the category of cerebral fat embolism syndrome, which means that the, the fat emboli leaks out from the fracture or wherever, and it migrates to the brain and causes infarct or ischemic changes within the brain. And that can then result in some of these neurological manifestations. So lastly, some of the skin manifestation can be seen or what is called petechial rashes. And these are really subtle as well, similar to neurological symptoms. They can occur in any part of your body, whether it be trunk, your arms, your legs, And this can occur in about 1/3% of the patient. And this is all in reference to the cohort that's described in the paper. And the paper reference is down here if you need to take a look at them. But you can see, so these are just particular images, and they're not necessarily specific to Duchenne's, but these are examples of particular rashes that you can see. So you can see it can occur on the arms, the legs, anywhere on the body, particularly the trunk, the front or the back. So always be on the lookout for this. So all of these signs and symptoms came from this paper, which was published in December of 2023, in which they looked at patients from the age of 10 to 23 years old. And what they see is the median age of presentation for this fat embolism syndrome occurs in the range of the median age of 14 and a half years old. And with the initial presentations of respiratory distress, right? So 21 out of 23 of these patients developed tachypnea, hypoxia, which is low oxygen in the blood. Also, tachypnea is just fast breathing, reduced vigilance. So this is a manifestation of neurological impairment or involvement, where they become confused, just not aware of the surrounding seizure, or just simply unresponsiveness. And all of this, then some of the other uncommon conditions also can be presented as well. And those are fever, blurry vision, petechial, that's the skin manifestations, and of course, severe headaches. Now, according to this cohort, this is the outcome numbers. It's not really favorable. It doesn't look too good, right? So what you can see is that roughly 54%, so 13 out of the entire cohort of 24, do have full recovery. But you can see from this graph and from this pie chart, 7 of them resulted in fatal mortality, death. A small subset will need respiratory support, neurological impairment, and 2 in this cohort resulted in severe neurological impairment. So this is where we need to really be on high alert to look at neurological symptoms and impairments of these patients. In this paper, they described a patient who is a 13-year-old with soft tissue surgery who underwent an elective soft tissue surgery, non-complicated. It was then discovered that this individual has a bilateral femoral fracture and marked osteopenia. Interestingly, this patient has never been on corticosteroids. And even 5 months post-surgery, the neurological outcome has not recovered and has been marked as minimal consciousness. So this is not what we want and not what we look for. Therefore, the hope is that the earlier recognition, the earlier intervention, the better outcome would be, but that's yet to be known with some of this case reports. So how can you prevent this? How can you prevent something as catastrophic as fat embolism syndrome? And some of the preventative measure can be really simple. Wear a seatbelt. So when you're in a scooter, power wheelchair, make sure you put on a seatbelt. Same thing as driving a car, right? So just put it on in the event that if the wheelchair or the power wheelchair or scooter get tip over, you're not then falling over and hitting the ground, causing fractures. Simple falls from wheelchair, shower chair, or even during transfer can cause some of these symptoms and sign resulting in fat embolism syndrome. So therefore, use assistive device such as Hoyer lift, perfect lift, any kind of assistive device that would prevent and help to reduce the risk of having falls or just a caregiver accidentally drop a patient during transfer. Also, keep in mind any post-operative monitoring needs to be high on your list, right? So even as a simple elective surgery, that still needs to be on the list because that's where we see most of this fat embolism occurs, whether it goes to your heart, your lungs, your brain, or any other part of your body. This needs to be on your high alert is after surgery. Um, and of course, the other obvious preventative measure is just be cautious during slippery environments, such as no water during bath when someone is really slippery from soaps or even water. Those are really high risk environment and situation where a falls or some kind of slippage can occur. So what happens when you see these signs and symptoms, right? Um, and and how can you um, communicate and what do you do in this situation? Um, of course, it's always easier said than done, but to remain calm if at all possible. And you, as a caregiver, as a parent, will be the strongest advocate for our patients, for our kids. And you're going to be the voice, you're going to be able to describe what to look for. Describe to them what Duchenne's is, describe to them the medications that they're on, describe to them the complications. There are a number of patient advocacy groups, including Jett's Foundation, have a lot of resources, useful resources that you can have on hand when entering these emergency situations. Use your community, use your doctors, your patient advocacy group, also social media, and anybody in the community that you know could help and knowledgeable and guide you to the appropriate resources. I created this QR for the research paper that described fat embolism syndrome and Duchenne muscular dystrophy. So hopefully it works. I'll leave it on, but this should give you access to the paper and you can provide this paper to the emergency staff so that they're aware of what to look for and how to manage your child or your loved ones. So this is a rather short presentation and it's very superficial for something that is so catastrophic. But the main purpose of this presentation is simply to raise awareness, what to look for, and there's still quite a bit of unknown out there. Um, you know, your fall doesn't have to be a significant fall or drastic fall. It could just be simple as slipping out from the wheelchair or just a fracture from simple transfer. So I hope that this doesn't cause more anxiety and more worries for you. I hope that you come away with this from this presentation knowing that this is one thing that it needs to be on my radar. This is something that unfortunately we'll need to add on to our list of daily activities and daily monitoring of our loved ones. And lastly, this is my contact. And of course, there's also the Jett Foundation contact as well. Alexa knows exactly how to get in touch with me. If there's any questions, feel free to send me an email, and I love to hear from you. And I hope that we can, as a community, prevent some of these catastrophic events. And if there is one, that it be reported so that cumulatively we can learn and lean from the experience and to help further and prevent some of these complications in our loved ones with Duchenne's muscular dystrophy. So thank you so much.
Yeah, no, I know that it was short and sweet, but I think that it is super important. And like you said, there's a lot of unknown, but I think that's why it's so important to have, Perlita and Yolanda here, because I think sharing the experience and how, they got through it and what they did is really important. And the QR code, like they said, did work. I grabbed
Okay.
it so that we can put it as a resource on our website, because that's something, Yolanda actually mentioned to me the other day, is we need things to actually, like, yes, she can advocate, but the doctors have to know what to do without her just, they need the step by step. So thank you for sharing that. So with that, I'm gonna have Perlita go ahead and start and share her experience with Levi. Um, Again, if you have any questions after she speaks, I do have them here, and we will get to them at the end. So Perlita, it is off to you.
Awesome. Thank you. Thank you, everyone. And thank you, Jett, for allowing me this platform to just kind of tell my story about what happened with our Levi. Levi's 18 now. He's a senior, and we live right outside of Hershey, Pennsylvania. And we go to Penn State Hershey Children's that just became a center of excellence for Duchenne. But back in right before COVID, in February of 2020, before everything happened, Levi fell out of a shower chair. And exactly what doctor said, we have to make sure that they have seatbelts. But when you go to your general DME, you just get that basic shower chair, right? That first shower chair, and most of them don't have seatbelts. So he did. My husband was pushing him, and he literally just nudged a little bit, and he fell out. So the one thing I would say is, if you have a partner, husband, you live with whoever, grandparents, make sure that your other half, or if you're a single parent, you have to know this. But again, those simple falls, if you think it's simple, it still warrants a lot of investigation. My husband isn't as involved. He does a lot of other things for Levi, but I do more of the educate, I know more of the education piece. And he said, let's just wait till tomorrow to go to the doctor. And I said, absolutely not. So my older boys called 911, and I was relatively calm, but when he got to the hospital, things changed, right? People, the ER doctors, even the pediatric side of the hospital, don't know Duchenne. They don't know FES. So it was very challenging to get them to understand. So when they do their chest x-ray, because that's one of the first things they do, is they say pneumonia. And the kiddo just fell. He doesn't have pneumonia. But that's like the easy thing to rule out. So, I kept talking to them about FES, but they just don't know, right? So what I have in my back pocket since then is that relationship with my DMD, with Levi's DMD neurologist, and our case nurse. Okay. So if you're lucky enough to have a specialty nurse when you're at your clinic visits, get to know them. Um, Ask for their cell numbers. You're not going to bombard them with simple questions, but when you are in an emergent situation, you want the people that don't know to talk to somebody that does know. Okay. And even though a parent, we know, but it's a crisis. And sometimes things just fly out of our head. Okay. We start saying things. And Levi, nobody really believed us, but Levi did have all the symptoms but one, but they were subtle. As Dr. Phan said, he did have the elevated heart rate. Okay. He did have, his pulse ox was a little off. He did say some things that were a little odd when it comes to that neurological piece. So that was, I knew that, but nobody else caught it, right? He was talking like gibberish. And it wasn't much, but it was just subtle enough that I knew, okay, that's another one. And I noticed that he did have the petechia, which is a little rash, and it wasn't a lot, but it was on his chest, and I didn't really notice it right away because he's got the gown on. He's got all kinds of stuff, but he did have everything. The one thing that concerned me was that those fat globules, when you break your femur, they travel and they can wind up in your, I guess, your eyes. So you want to have, if you want to rule it out, you might need a pediatric ophthalmologist. Nobody listened to me. They didn't. And as soon as I started saying, some things that were really intense, then all of a sudden we got a pediatric ophthalmology consult. And Levi did not have the fat globules. They didn't go to his eyes, but he had all the other symptoms. We did get everybody involved. He had a lot of pulmonary physical therapy because there's really no cure for it. You can't just pop a pill, right, to do this. So the conversations did start with my pediatric neurologist and like the ER doctors and the attendings, because the attendings, they're usually pediatricians and they don't know Duchenne. So you've got to have that communication with your team that at any given urgent time, you may be calling them to talk to, Dr. Smith that doesn't really understand. So don't take these falls lightly. Levi's, he didn't have to have surgery, but we were nervous and we had to have his bed moved into the living room so we could help him a little easier. And that was a whole other issue, which was interesting. But I think we lose kiddos and young adults to this, and because people are unaware. But they did do a lot of PT, a lot of pulmonary PT. The chest, they used the vest. They did a lot of his BiPAP continued cough assist, like around the clock. And that's what really helped. But he was in the hospital for about a week. So again, my takeaway is talk to your doctors, make sure you have their contact information for that emergency call, because as a parent, sometimes it's just hard to have all those thoughts and convey them properly. So thank you very much. And I appreciate being here, and I'll send it off to Yulanda.
And I will mention one thing while she's unmuting herself. I think that if you don't have the privilege of having a team like Perlita, I lean on other families, and I think that's something Yulanda will talk about, but lean on other families to be able to connect with physicians or to connect with people that do have an understanding, because this community can definitely rally together to help you. So with that, I will hand it off to Yulanda.
Hi, I am Yulanda, and I have 5 kids, and William is my youngest with Duchenne. He thoroughly he just loves being the baby, and then adding this on, he gets all of our special treatment here. But thank you again for letting me share my story. So let me just get into it. It was a simple fall. What we thought, he was on the toilet, his aid was here. We have the little bars that go down. We didn't think anything of it. I'm thinking, oh, it was just this little fall, but he's freaking out. But William, he freaks out with every fall, or not fall, but any little thing. Like if he sees a little bump on him, he screams about that. So it was really hard, but this was just different. It was different because we couldn't even touch him to get him up. So I immediately knew, just from being part of, watching some of these webinars or whatever, that this was something we had to act fast with, especially when we couldn't touch him to move him. So we called 911. The operator takes all my information. They show up. Let me just start with this part too. The 911 staff, they show up and they're like, "Oh, I hear he has MS." No, he does not. And that's always a common thing that I always have to seem to correct everyone with. But long story short, we ended up in the emergency room. I literally walk in there holding the PJ's protocol, saying, "Let's look for this. This is what he's gonna have." I know it. We've lost friends with this, and it had recently happened prior to July. A couple boys that I had just been looking at, so it was still fresh in my mind that, hey, this can happen, and I'm prepared. I have the tag hanging from the back of his wheelchair. So immediately, I think within the first 2 hours, I got some notes here. William's heart rate started going up, 150 to 170s. His respiratory rate was in the 50s. He started getting a temperature just right off the bat. They do the chest x-ray, like Perlita had said. They're saying, oh, he has pneumonia. I'm like, he didn't have pneumonia. How does he have pneumonia now? This is what you need to be looking for. And I knew in the back of my head, just listening to our community and always staying up to date, that this is something that they're going to say. He has pneumonia, right? So I said, he doesn't have pneumonia. This is what we need to look for. And mind you, I'm a nurse. I've been a nurse for 26 years. But all that goes out the window. I feel like when you're a mom, you're just being a mom and you're scared and it's frightening. You know, this happened in July again. So it's still really hard for me to even talk about, because you feel like all of this is on you. If you don't say the right thing, if you don't speak up quick enough, are they going to let my kid die? Because immediately I felt like I really wasn't being listened to. Because when I feel like sometimes just being in the medical field, if you say, hey, I'm a nurse, they think that you just want to be right about everything, or you're just going to be that parent. Well, I'm never that parent. I'm his parent. So, sorry, I knew this was going to happen. I tried. I'm trying here.
No, you're doing so good. You're doing so good.
Okay, thank you. So we ended up with a crisis unit to go downtown. Again, Cincinnati Children's Hospital is our hospital. So we're the best, right? Or one of the best. I shouldn't say the best. We're all good. But I feel like I'm going to be in safe hands. Finally, we're getting the crisis unit. They got us there. We're going downtown, right? We get downtown and I still feel like, and I call the DMD clinic on the way, but it reroutes me to the main hospital number. So I even told them that needs to be changed, because you're telling me to call you when something happens. I'm calling, you're just rerouting me to the main number. I'm in crisis mode. I can't think right now. I don't have time to keep dealing with this. I'm sitting in the ambulance with my kid in the transport unit. So we get down there. Still, I don't feel like I'm being heard. They another chest x-ray and still clear, right? Heart rate continues to go up. They're giving him pain meds. They're giving him IV fluids. He's still breathing in the 50s. He always keeps, like, it looks like a little rash on his chest. So I really didn't think anything of it, but he had everything else. He had everything else except that little rash, but you don't have to have all of them. I think when I was looking it up, you have to have 2 or 3 of this section and 1 of this section, which was also very hard for me to look up while I'm in crisis mode and trying to prove my point. They've ended up, William wears a BiPAP at night already. So the floor that we went on, they ended up putting him on a BiPAP and he needed it all day. So they couldn't keep him on that floor. So then we go over to the ICU. They switch him over to a vent settings. Still, you know, they do a CAT scan. CAT scan says he doesn't have this, and still confirming, you know, I'm not right. I'm not trying to be right. I'm just trying to throw out the information. The ICU doctor said to me, if you're right, then tell me what I need to do for treatment. I didn't even think about that. I was just following the list, but I did know it was high flow oxygen, give them the best. I'm sorry, of course, somebody tries to beep in here. I knew it was all of these things, but you know, you just can't think. And I thought, how rude of him to ask me, like, why don't you know, if you know this is what I'm saying? If I'm telling you this, why don't you come to me with, hey, Miss Kiser, we're doing everything. If he has this syndrome, we're doing everything we can for your son to put all of us at ease, instead of and that was in front of like a panel of 8 people because we were doing a care conference in the hallway. It was very intimidating. It was frustrating. It was embarrassing because I did know, but I couldn't think. And I shouldn't have had to, honestly. I shouldn't have had to. But again, we were still, his stuff started coming down and things started changing. They started doing the shaker vest, doing the cough assist, because we do the cough assist daily anyway here. So we kept all of that thing up. What they added was the shaker vest. Before all that, though, I messed around somewhere and missed this part. In the middle of that, I was posting on Facebook, somebody help us, please. I'm doing something wrong here. And I did. I had the moms reach out, and it was so nice because they gave me the phone numbers you moms are amazing. You went into action, gave me the phone number to call and who I needed to call to get the neurological team down there, which mine was on vacation. And then his backup was going on vacation the following morning. So there was this other man that came. He was really nice. He watched William sleep on the pain meds, changed all his vent settings around to where they needed to be. And within 24 hours, I started seeing hope that he wasn't going to die, because I really felt like he was. Anyway, I just want to say there's so much in the power of that. And instead of saying, hey, did you give him the protocol? Yeah, I gave him the protocol. I told him about PJ's protocol. I went over it myself. I was looking things up myself, but I like the QR code idea. I like it that we can say something to the doctors about, here it is. That way it's not really our responsibility. And if things go south, it's still not on us that things went south, because we will beat ourselves up about it. But William's doing great now. And I definitely reach out every chance I get if I see that someone's going through this, because it's needed. We need to be here for each other. We're a small community. And we have each other's backs, and that situation, I'm so thankful. I know everyone knows who Dana is, but she really helped me a lot to get through this, and I'll never forget that, because when I couldn't think, because I feel like I'm a strong advocate, but you never know how you're gonna be and where this is gonna put you when you feel like the team that's supposed to be helping you, it feels like they're working against you. And I know that wasn't the case, but it really felt that way. And none of us should ever be put in that position. And, I even spoke to children's about that this was wrong. This was wrong on so many levels. And just because they weren't educated to the situation, maybe that's your gap. They need to be educated. And they also need, I needed a little bit better bedside manner, because when William was kind of talking out of his head, they were telling him to be quiet and there's other kids on the floor. I felt like, am I in the Twilight Zone, or am I in a hospital here, Anyway, the end of the story is William is doing great, and we definitely all learned a valuable lesson. And if I can move forward and help whoever I can, I'm always ready to assist, take any questions, or be Dana for you, that she was for me. And there was another mom too. I'm so sorry I didn't write her name down, but we need that in our community. We really do. So is that, are we good?
No,
Okay.
Yulanda,
Sorry, I lost my train of thought.
No, it was perfect. I think that's, thank you for sharing your story, because I do know it's raw, and it's like you said, it wasn't a positive experience, and similar to Perlita, not a positive experience. So we are so happy that William is doing well, that you were able to lean on other families and get the help that you needed. And so
we were there 11 days.
Yeah.
11 days.
Perlita said Levi was there for what, a week? Yeah.
Oh.
So thank you guys. I do think, the education is so important, but it's also so important to hear the real life stories too. So
another thing that William did have, that I feel like he had, but they didn't end up, because at that point, I don't know that they were moving any forward, but he did have the striations in his eyes. I had posted some pictures and things on Facebook. It was in this area of his eyes. I don't know if that's something that anyone else has. Well, you did say that, never mind. But that was something that was also there after like day 3 that we noticed, because I didn't even look, so.
I mean, people probably don't think to look, right?
Yeah.
So that's a good point. Well, thank you guys again. We do have some questions that Dr. Phan already answered. So I'm just, if anybody else has these questions, weight is not a determining factor for FES. So that is a myth if you've already heard that. and it can cause strokes similar to blood clots. So, Dr. Phan, I will ask the question about the female carriers. So if someone has been diagnosed as a carrier of DMD manifesting or not, are they possibly more at risk for FES?
So I'm assuming that they're referring to female carriers, because I think the question also mentioned non-carriers.
So I think like as, a female carrier of DMD versus someone who obviously has not been diagnosed as a carrier. Yes.
Sure, sure. As far as I can tell from my research in the literature and some of the reports, there has been no reports of female carriers suffering from FES. I so I don't know what the right answer to that question is, but there so far has not been any reported case on female carriers for FES. I do, Alexa, I wonder if is there a mechanism or a way for us to, as patient advocacy group and as community, to report some of these case reports, like, Perlita and Yulanda. I'm sure they're not in that paper that I was looking at, but they're extremely important for a number of reasons, right? So things to look for, how to communicate with the hospitals, hospital staff, and your treating team. I think all of those are really important, because, I can only imagine, knowing the catastrophic outcome of your child and trying to calmly communicate, look, this could happen to the medical team, can be so daunting. So, but I think the more we report these cases and the more we raise awareness to this type of syndromes and catastrophic events, the better it is that the medical community will be able to recognize that. So I don't know if Jett Foundation or anyone else know of a way or of something to record this, because I'm sure there's a number of unreported cases out there.
Yeah, no, I think that's, and to your point, even about female carriers, right, is there may not be research because it's not being reported. It doesn't mean that it's not happening, right? So it's definitely something I'm going to look into, and also something Yulanda brought up too. So definitely a lot more that we can do to raise awareness in this area. You did not mention that, Yulanda, if you want to put that out there.
Something I didn't mention, which was one of my bullet points, was his CAT scan was read incorrectly at first. And it wasn't until the neuro team doc came down to tell the rest of the care team that it was read incorrectly, that the rest from day 4 to 11, they actually listened to what I had to say. So I wanted to go back to the ICU, but I'm not that person, and say, I told you, to that doctor, I told you, but I didn't have enough energy to do that at that point. I don't know if they would have let me in. But anyway, it was read incorrectly. And not that I wanted to be right. I did not want to be right, but I was right. And they should have listened. And I think that was the takeaway at Cincinnati Children's. I'm sure they're not going to forget me, because as I'm being tearful here, I was being tearful and angry there. So because they wouldn't listen. But I think they listened after that. After a colleague kind of, I don't want to say egg on the face, but gave it back to them. And he said, she was right. In front of me, she was right. And that's what I needed to know, that I advocated the way that I needed to advocate. And I did everything right. I did everything right. That's what was important. That we are packed with knowledge when we go in here for our boys. Always have the knowledge that you need. And that's what I think, that's why I'm saying about having even your QR code. I haven't looked it up yet, but something to say when we are distraught, because it's very easy to get that way when you think your child's life is on the line, to say, this is what he has, here's the bullet points, and here's what I need you to do. But I had to keep looking for what to do. And it was probably right there, but I couldn't see it because I was so upset. I couldn't find what I needed. And that was the frustrating part. So, and lack of sleep, mind you, by that day, that was 4 days with no sleep. So I don't know. I think they expected a lot for me. Like, I'm not going to school for this. You did, but I'm here. Let's educate each other. Let's move forward, and let's just do the best that we can on being packed with our knowledge so that we can save our kids, because a lot of times it's us and they need to listen to us. You know, they need to, because we know our kiddos. Right.
Absolutely. Absolutely. Well, thank you all again for being here. If you do have any questions, I haven't seen any more come through. I don't see any on Facebook, but if you do have any more questions, Dr. Phan did provide her email, but you can also reach out to us at info@jettfoundation.org or personally to me at alexa@jettfoundation.org, and we will get questions to the appropriate people. If you do, I do encourage you, if you have had experiences with FES, please reach out to us, because I really do love the idea of somehow, you know, doing something with that. So absolutely private, but please, if you are willing to share your experiences with us so that we can maybe put something together in the future, I think that that would be really beneficial. So again, thank you, Dr. Phan, Yulanda, Perlita, for being here. Thank you all for being here and listening. We appreciate you. This will be, like I said, this is recorded and will be available later on our YouTube, and will be available for you to share on Facebook as well. So we will see you soon. And thank you all again for being here. Appreciate all of you. Have a wonderful day.
Thank you so much.